FootJelly, the extra hand in foot care. I'm Dr. Robert Spalding, CEO of footjelly.com, medinail.com, and justfortoenails.com. How much have you invested in retailing creams, lotions, and foams as a physician? How much time have you spent writing prescriptions for topical medication as a physician? Here are some application devices on Amazon to help your patients self-apply creams, lotions, and foam products on their feet. These devices offer very little pressure to rub in the foot care product. How many patients who come to see physicians can't reach their feet or have difficulty reaching their feet for daily foot care? It varies from practice to practice, but can range from 20% to 50% of the physician's practice. Affected individuals would include obese individuals of any age, limited mobility clients from back, knee, hip surgery, or seniors with arthritis, orthostatic hypotension, or other physical problems who could have difficulty reaching their feet for daily foot care. More Americans are becoming obese and have permanent surgeries or medical problems and can't reach their feet to apply creams or provide routine foot care for themselves. Daily foot care is critical to prevent serious consequences for diabetics, vascular patients, and neuropathic patients. This includes the daily use of creams, lotions, foams, and sprays to prevent dry plantar skin or foot fissures leading to infections that can lead to amputations. Here are some interesting U.S. statistics. 38 million people are diagnosed with diabetes, representing 11.6% of the U.S. population, according to the CDC. 10 million people have peripheral artery disease, and some of those have critical limb ischemia, making them at risk immediately for amputations. 25 million people are estimated to have peripheral neuropathy, according to OHSU Brain Institute, and 81 million people have dry skin, making them more at risk for fissures and possible infections. How many times have you, as a physician, prescribed or recommended a topical medication to patients, only to suspect that they may not be able to perform the task of accessing their feet and possibly make the foot care product an unnecessary expense? Do you ask your patients if they can reach their feet? Do you ask if they have a caregiver or relative to help apply the product? Many times patients are embarrassed to tell the physicians that they cannot reach their feet due to obesity. Do you prescribe or retail products like these in your office? Think, is it ethical to sell or prescribe foot creams, lotions, or foams if the patient cannot reach their feet for daily applications? So how did the FootJelly come to my mind? As I became a diabetic with neuropathy and became overweight, I noticed to take care of my feet, it got harder to apply creams to myself to prevent dry, cracked skin. I've started having more empathy for my patients, who I had been writing prescriptions for topical medications or recommending OTC creams, lotions, and sprays for all these years. I looked at the long-handled sponges and tools that are out there on the market to apply creams and lotions, but none offered the ability to smooth on any creams and foams without creating a mess, and or with real force to massage the creams where I needed it. That's when I came up with the idea for FootJelly. FootJelly is a 100% skin-safe, soft, conforming silicone product that's poured and cured in a tub that's impervious to water, creams, sprays, lotions, or foams. Silicone allows the foot care products to be used more judiciously, has inherent medical healing benefits, and allows the lower extremity muscles to work with force of gravity to penetrate the skin with creams and lotions with more pressure by utilizing the intrinsic muscles of the foot. 100% medical grade silicone is used by plastic surgeons to reduce scarring and keloid formation post-operatively, and also used in burn wards due to the beneficial medical properties of silicone with the skin. Take the FootJelly test. Here are many of the advantages of FootJelly. Number one, It's a cream, lotion, and foam easy application device. Number 2, for exercising intrinsic foot and leg muscles. Number 3, a physical therapy balance exercising device. Number 4, a physical therapy thermal heat or cold therapy device. Number 5, a relaxation massage therapy device for nail techs. Number 6, an advanced foot soaking device for patients and clients. Number 7, it can be easily washed with soap and water and completely disinfected with hypochlorous acid. Number 8, the customized FootJelly version increases the contact surface areas of the foot and stabilizes the feet for exercises. This costs a bit more than the basic unit. Number 9, it greatly improves compliance with topical prescription medication therapies and the preventative OTC foot care products. And number 10, several patients have reported improvement in their neuropathy and the ability to feel their feet. Number 1, FootJelly allows improved penetration of creams, lotions, and foams by gravity forces on the lower extremity and larger muscle groups via a simple application device, especially for limited mobility or obese patients. FootJelly is good for treating athlete's foot, and the use of other prescription topical medications to treat fissures, psoriasis, eczema, and contact dermatitis from certain allergens to reduce inflammation. Number 2, for deep exercising of intrinsic foot and leg muscles that improves circulation of the digits. Number 3, FootJelly acts as a deep physical therapy exercising device that improves circulation, that improves range of motion and strength for better purchasing of digits, which may improve balance. Number 4, it acts as a physical therapy device that can deliver heat via the microwave, a heating pad, or hot or warm water, or cold modalities like putting it in the refrigerator or freezer for pain, inflammation, edema, and surgical post-op therapies. Number 5, FootJelly can be used as a relaxation massage therapy device for nail technicians to use as part of their services or for personal home use. Relaxation reduces stress, anxiety, and potentially blood pressure. Number 6, FootJelly can be used as an advanced soaking device for patients or clients to use with any soaking agents. Number 7, FootJelly is easily washed with soap and water and completely disinfected with hypochlorous acid. Hypochlorous acid can also be used on skin for foot infections in combination with silicone while treating foot ulcers, calming the inflammation. FootJelly recharges itself with its own internal silicone oil. Number 8, customized FootJelly greatly increases the contact surface areas of the foot and stabilizes the feet for exercises and physical therapy. Number 9, FootJelly significantly improves compliance with topical prescription medication therapies and preventative OTC foot care products. You can see better medical outcomes and increase sales with FootJelly. Number 10, my patients have reported through exercising their intrinsic foot muscles with FootJelly, this increases circulation to the nerves, which noticeably improves their neuropathic pain symptoms. Remember, before FootJelly, health professionals just told patients to pick up marbles with their toes to exercise their digits. Now, there is a much more comfortable way. How to use super soft FootJelly. Place your favorite cream, lotion, or foam in 2 straight lines on the surface of FootJelly. Place your heel on the bottom of the product line and press firmly and rotate to get the maximum absorption. Repeat this procedure with the forefoot. Rub your heels together to spread more product around and massage into your feet and the ball of the forefoot together. Super soft FootJelly feels tacky at first, but immediately disappears with the use of any foot care skin softening product, hypochlorous acid, or water. However, the super soft foot jelly has more silicone oils that reduce skin friction and shearing forces and offers healing factors to skin. There are many FootJelly target sales markets in the U.S. There's compounding pharmacies, there's orthotic clinics, podiatrists, physical therapy clinics, nail salons, nursing homes, home health agencies. There's primary care physicians, dermatologists, orthopedists, and family nurse practitioners, just to name a few, which represents over 500,000 target sales potential. To accomplish these sales, you can either use one, a direct sales force, or two, incentives to medical practitioners to purchase and use on their patients. Number three, incentives to nail technicians to use as a service in their salons. And number four is direct web-based internet sales at footjelly.com. On the footjelly.com web custom order page, the first basic 1-inch small tub retails for $2.99. The FootJelly Basic 2-inch large tub starts at $4.99, and the customized molded FootJelly is around $799. So what is the $1,000,000 question? How much money do I make? So the basic 1-inch small tub unit retails online for $2.99. You can buy it wholesale for $1.99, and your profit is $100. The basic 2-inch small tub unit retails online for $4.99. You can buy it wholesale at $3.49, and your profit is $150. A custom molded small tub unit is $6.99. You can buy it wholesale at $4.99, and your profit is $200. You can make more if you decide to become an associate custom manufacturer and purchase a FootJelly custom molding kit. FootJelly kits can be sold to anyone with a desire to custom manufacture FootJelly. Special information: don't worry if the FootJelly separates from the edges of the plastic tub or comes free. It is made to do that. Just place the FootJelly back in the tub and use hypochlorous acid to periodically clean the surfaces if you feel the need to do so. Otherwise, it's optional. But if you ever get your feet dirty from walking barefoot, use the hypochlorous acid to kill everything on the skin and the surfaces of FootJelly. Warning number 1. Most people are not allergic to silicone, but allergies do occur. A silicone allergy can trigger a contact dermatitis that would appear as a rash, red hot, or swollen skin. Silicone is contained in many products, cosmetics, shampoos, hair conditioners, squishy toys, electronics, earplugs, waterproof clothing with Scotchgard, which is 20% silicone, or similar waterproofing for shoes, bras, some kitchen tool handles and oven mitts, adhesive on Band-Aids, watch brand, personal lubricants, foot creams, medical implants, medical devices, and catheters. If you are concerned, try the available FootJelly samples to see if you are allergic to silicone before you purchase FootJelly. I would categorize this as being allergic to nail polish, acrylics or gel nails, cyanoacrylates, and many other beauty products. There's a great article on silicone allergies below. Warning number 2. If you choose to stand on FootJelly to experience the full ability of the product, be sure to have someone to help you stand up from a chair and sit down, or use a walker, cane, or firm surface that holds your weight to avoid slipping or falling from the tub, moving while you bear weight on the FootJelly surface. Remember to prevent falls by close supervision. FootJelly may be covered with a letter of medical necessity. Reasons for FootJelly to be covered with certain types of insurance with certain medical conditions such as diabetic neuropathy. In other words, peripheral neuropathy. There are 16 different causes for neuropathy: vascular problems, edema, venous stasis, and arterial peripheral arteries disease, dermatological conditions affecting the feet, in conjunction with difficulty in reaching the feet from limited mobility from back, neck, hip, or knee surgery, arthritis, in the hands or spine, and orthostatic hypotension from bending down. A letter of medical necessity may help you get FootJelly reimbursed with a health savings account or a flexible savings account, with an example to follow. The letter of medical necessity must include a diagnosis and supportive reasons for needing the FootJelly device by a firm request to cover FootJelly for the patient. The following is an actual letter that was recently approved by a health savings account insurance company, and you can look at the full letter in detail at footjelly.com. Here's an actual approved letter of medical necessity. You can see the elements that support the diagnosis and the request. Manufacturing would be accomplished three different ways. First, we would have a centralized area, a fabrication area in Chattanooga for internet orders and basic units or custom units. Number two, approach the orthotic labs or podiatry clinics. If they want to manufacture the custom units, they're experts at capturing those foot foam boxes to acquire the shape of the foot for the custom. And this only has 20, basic orthotic has 21 steps. This one has about 10 steps, so it's easier to make. And number three, sales kits to podiatry offices or medical clinics or anyone who wants to set up a local distribution and manufacturing site for custom units. We can manufacture FootJelly in three different ways. With a centralized area facility in Chattanooga for internet orders and basic units or custom units. Certain orthotic podiatry clinics and certified podorthists for custom units to be made, and sales kits to podiatry offices, medical clinics, or anyone like CPEDS who wants to set up a local distribution site for custom units. Marketing. Number one, let people try FootJelly samples to see how slick their fingers get, and as a health tester to see if they are allergic to silicone products. Number two, have samples in tubs or just a station at various public areas to have anyone just simply touch the FootJelly with their fingers and then rub their fingers together and feel the slick, smooth silicone qualities. Number three, set up to promote the product. In other words, try FootJelly with their feet at high traffic areas, at salons, shoe stores, shopping malls, conferences, sporting events, running competitions, podiatry offices, healthcare fairs, and drugstores, and market to the physical therapist. Here are some recent ads in podiatry management, news, and Indiegogo. Remember, the beauty industry promotes and sells large numbers of creams, lotions, sprays, and foams. The advantages of FootJelly will promote all beauty manufacturers and distributors of these foot care product lines, as it accentuates all the properties of these foot creams. Based on my 25 years of experience, many reasons exist to use FootJelly. You get more power with the legs and feet versus the upper extremity hands for rubbing in for absorption. You get more pressure or weight in the lower extremity, and that puts more pressure on the product to rub it in, as well as more penetration collectively. Use FootJelly with any of your favorite creams or lotions or prescribed products. In conclusion, what can FootJelly accomplish? Experience super smooth feet and a slick, soft touch. Reduce dry, cracking plantar skin. Reduce shearing and friction forces. Reduce potential for blisters or callus formation. Reduce potential for ulcerations. Reduce potential for symptoms of neuropathy. Reduce inflammation with thermal control. Increase circulation by exercising intrinsic muscles. Increase physical therapy options for post-operative patients. Increase potential for revenue streams. And remember, FootJelly is the extra hand in foot care. FootJelly makes foot care fun. FootJelly is now protected with a filed trademark with this serial number and a provisional patent with this serial number. Other FootJelly related products will be available soon for other areas of the body. Thank you. We look forward to your support of FootJelly. You can contact me at this following email, drrspalding@gmail.com, or at this telephone number below.